Hello everyone, my name is Raghi Mikhail. I am a postdoc at Yale School of Medicine, and for the last 10 years I've been working on colorectal cancer. In this video I would like to talk about non-hereditary risk factors that have been associated with the development of colorectal cancer in individuals under the age of 50 years old. So one of the risk factors that have been associated with this malignancy is a westernized diet, a diet high in saturated fat, rich in red meat and low in fibers. Is a well-known risk factor for developing colorectal cancer. This type of diet promotes dysbiosis, which is an imbalance of gut bacteria, and generate pro-inflammatory and pro-carcinogenic advanced glycation end products, increasing the risk of developing colorectal cancer in young individuals. In addition, certain dietary additives, for example, monosodium glutamate and titanium dioxide, which have been associated with tumorigenesis in animal models, may also contribute to developing colorectal cancer in individuals under the age of 50 years. Another risk factor that has been associated with developing colorectal cancer is obesity, which is characterized by a body mass index above 30 and is a well-defined risk factor for developing colorectal cancer in later life. However, obesity has also been postulated to drive early onset colorectal cancer because of its global increase, promotion of dysbiosis, and known pro-inflammatory and pro-carcinogenic effects. One of the cohort studies analyzed more than 85,000 women and found that those with obesity had double risk of early onset colorectal cancer compared to those with normal body mass index. Another risk factor that has been associated with developing early onset colorectal cancer is type 2 diabetes, in which the incidence has also been increasing globally. In a Swedish cohort study, individuals with type 2 diabetes under the age of 50 years old had 3.5-fold increased risk of developing colorectal cancer compared to those without type 2 diabetes. And in one of the projects that I worked on during my PhD, we also found a significant association between personal history of type 2 diabetes and colorectal cancer in individuals under the age of 55 years old. In addition, several epidemiological studies have found an association between antibiotic use and colorectal cancer. Exposure to antibiotics during pregnancy or early childhood may lead to change in gut bacteria and potentially increase the risk of developing colorectal cancer. However, we need more research to fully understand the association of antibiotic use and developing colorectal cancer in individuals under the age of 50 years old. The last factor that has been associated with developing early onset colorectal cancer is gut microbiome and dysbiosis in gut bacteria, which is characterized as imbalance of beneficial and harmful bacteria in the gut. Certain bacteria such as Escherichia coli and Fusobacterium nucleatum have been identified as key organisms for colon-carcinogenesis, and change in the gut microbiome can be influenced by different factors, including obesity and diet, affecting gastrointestinal tract susceptibility to carcinogenesis. So in summary, westernized diet, obesity, type 2 diabetes, lack of physical activity, using antibiotic, as well as dysbiosis in the gut microbiome are the risk factors that have been associated with early onset colorectal cancer.